Okay, welcome everybody. Sorry for those little technical glitches there. Welcome to the launch of the 2025 Health Translation SA MRFF Catalyst Grant Scheme. This scheme is made possible through the generous support of our funders, our scheme funders, so the Hospital Research Foundation Group, the Women's and Children's Hospital Foundation, and the Cancer Council of South Australia. My name is Rebecca Perry and I lead the priority-driven research development portfolio here at HTSA. And I'm really looking forward to launching this scheme today. And this is the third round of this grant scheme. So it's really exciting to see it just continuing to grow and grow. So before we get started, I do want to acknowledge that I am coming to you from Kaurna land, and I acknowledge the Kaurna people as the traditional custodians of the Adelaide region. And I recognise that the Kaurna people's cultural, spiritual, physical and emotional connection to the land. And I'd just like to pay my respects to Kaurna elders past, present and emerging. So a quick overview of what we'll be covering off over the next little while. I'd like to give an overview of Health Translation SA. We've got a number of people that have registered today who perhaps don't know too much about what we do. So this is a great opportunity just to bring everyone onto the same page. I'll then discuss the Catalyst Grant Scheme sort of in a general nature, and then we'll do a bit of a deep dive into some of the key points from the funding guidelines. If you do have any questions, please type them into the chat feature and we will be able to answer those at the end. Or if we do run out of time, we are developing a frequently asked questions document that will be available on the website, on the HTSA website. So you'll be able to refer to that as well. Okay, so Health Translation SA, who are we? So we are South Australia's only NHMRC accredited research translation centre. So we act as an independent broker, or you could say catalyst, to mobilise collaborations across our partners and other key stakeholders, really to enable the adoption of research outcomes across the SA health system. And ultimately, you know, we're aiming to improve health outcomes for our population. So we do have a statewide remit and we're supported by 11 partner organisations. So they're listed down the bottom of this screen. So we've got SA Health, SAMRI, Flinders University, the University of Adelaide, UniSA, the Aboriginal Health Council of South Australia, the two PHNs, so Country SA Primary Health Network and the Adelaide PHN, the Commission on Excellence and Innovation in Health, Torrens University Australia and the CSIRO. So those 11 partner organisations are vital to help guide us around what we do and develop our strategy. So I'll talk about that in a few minutes. And that's from a state focus, but then also thinking more broadly, nationally. We are one of 12 accredited research translation centres around the country, and then there's two other emerging centres. So those 14 centres each represents a partnership of multiple health services who are connected to research centres and universities. And so the 14 centres are all members of ARA, the Australian Health Research Alliance. And so this umbrella group and this collaboration between all of those 14 centres encompasses over 90% of researchers and 86% of acute care health services across Australia. So I just wanted to mention that because by engaging with us as your statewide Research Translation Centre, you're also able to connect into the ARA network nationally. So we're able to help facilitate those connections where appropriate. So please, engage with us and let us help facilitate those connections for you. It's also important, I think, to just recognise that the RTCs are addressing the objective of the NH and MRC's Research Translation Centre scheme. So you can see the objectives of the scheme listed there. We've got promoting leadership in health services research, strengthening collaborations, training and education, capacity and capability, and those I guess those key goals are reflected in our strategy, our own HTSA strategy, which I'd just like to go through now, because I think, as I mentioned, this strategy was shaped by input from our 11 partner organisations, as well as other key stakeholders within the health research translation ecosystem in SA. And this was developed early last year. And you can see that we've got 3 strategic priorities in underpinning our strategy. And what I'd like to do now is just go through each of those and to see, what that actually looks like, how we're operationalising this. So up the top, I have highlighted the Catalyst Grant Scheme, which is why we're all here today. And that is addressing that first strategic priority. So strategic priority 1 is to address key health issues, and specifically by strengthening collaborations to address key health issues affecting the state, and specifically by mobilising coalitions to deliver translational research projects that address priorities. And hopefully after today, it will be very clear why the Catalyst Grant Scheme, why that has been designed the way that it has been to help address this strategic priority, and also to benefit the state as well. Strategic priority 2 is around optimising the system. So we've got just some examples of a couple of documents all available on our website that really illustrate the work that we're doing in this space to really optimise the system, to streamline processes and reduce barriers to enhance the effectiveness of research translation. So we have a position paper here around the importance of embedding research into the health system, both for the benefit of consumers, but also for worker satisfaction and workforce development and retention. The HTSA program is a very large piece of work, a national piece of work, and HTSA is leading the South Australian node of that national piece of work, and that's really building an infrastructure to support the sharing and reuse of health research data. So really increasing the impact of the research and the reach and the scale of research that's being conducted nationally, and we're working hard to build that to its maximum potential here in South Australia. And perhaps of interest to people individually, the work that we do in our strategic priority 3 around empowering the people offers lots of opportunities for professional development, networks, engaging with key experts in areas of consumer and community involvement in research, in implementation science. We have the Women's Health Research Translation Network. These are all networks that anyone is welcome to join if you're working in health research translation and wishing to upskill around consumer and community involvement. Tap into our network there. We have a masterclass coming up in September that you may be interested in registering for. The Implementation Science Network has its next forum coming up next Monday, the 23rd. You're welcome to attend that. We've got our next Research Translation Essentials course being offered in early November. And next month, we've got our next Spotlight series that will be available, and that's focusing on engaging with specific populations when undertaking consumer and community involvement. So please feel free to jump on our website and or follow us on LinkedIn or contact us via email about how you can get yourself involved in these networks and these courses and these professional development opportunities. They will also, these all align with the key foundations of what would underpin a really competitive application to the Catalyst Grant Scheme and going on beyond to the MRFF. So use the networks that we have available to strengthen your grant applications and your research impact. Okay, so the Catalyst Grant Scheme. So what is it all about? So the Catalyst provides targeted funds to develop a pipeline of health service-led collaborative research projects that address health system needs in South Australia, and importantly, that are aligned with the MRFF principles and priorities. So the aim of the scheme is really to focus the translational research efforts of South Australia around the MRFF priorities, with the intent of strengthening the competitiveness of SA-led applications to the MRFF. So why are we doing this? So a few years ago, probably in around 2021, 22, we undertook a piece of work with our SA MRFF network, and we really identified, and things have definitely changed over the last few years, but there was a clear, it was clear that SA wasn't getting a very big bite of the MRFF funding pie. So we identified that it would be great to build a pipeline of health service-led projects and also develop researchers to be able to win MRFF funding and to be able to submit proposals that were going to be competitive and attract funding into South Australia. So that was a very, I guess, specific SA focused reason to develop the Catalyst Grant Scheme. More broadly, and this is more a universal problem, there's a need to improve the rates of translation of research into practice. So breaking down those barriers between research or researchers and clinicians or health service administrators, and really facilitating, connections to ensure that research that is being designed or delivered is feasible and really addressing needs of the health system. We identified that, there absolutely are a number of really fantastic seed grant schemes already available in South Australia. A lot were focused within institutions or departments or colleges within universities, and we were looking to develop something that was able to be cross-institutional, multidisciplinary and collaborative. So really looking to encourage teams to think beyond their organisational borders and encourage that sort of collaboration. We were also hearing from clinicians and also researchers that it was really, well, clinicians who were interested in dipping their toes into into doing some research, that it was hard to be competitive or find schemes that were suitable for them to apply for. And also, we knew that we were losing a lot of early and mid-career researchers to interstate. So to be able to offer a scheme that would support early stage researchers to then go on to attract larger amounts of funding through more competitive schemes was something that was also needed. And we also knew from speaking with our flagship programs, so these are programs of work that HTSA have supported over a number of years, that this was the type of funding scheme that they would be looking for as well to fund their work to take that next step, to scale up, to have greater impact. And then I think also we kept hearing again and again that South Australia is, it's small enough to be really, truly, deeply collaborative and also big enough to be competitive. So we really have to be able to, what people were telling us, that we needed to be able to leverage that benefit of being collaborative to take that, to use that to be more competitive on the national and international stage. So there are a lot of the reasons as to why this program's been developed and then have gone on to underpin the objectives and the way it's been designed, which I think is important to appreciate when you're putting your application together. And then, of course, it is essentially the intent of the program is that it will increase the number of essay-led applications to the MRFF. So that's recognising that this is a relatively new funding scheme on the landscape, and that it does to some degree require a bit of a shift in mindset for researchers and teams and institutions, and the way that the types of proposals that the MRFF would consider to be attractive or competitive may need a little bit of new ways of thinking than perhaps more traditional funding schemes have. So we really wanted to design something that was going to help with that mindset shift. But perhaps it's more interesting to hear from people that have actually been awarded Catalyst funding, and let them tell you why it's made a difference and why it has been so beneficial. So we've just got some selected quotes here from some of the awardees from the first round of the Catalyst Grant Scheme, which was in 2023. So really, they've identified that it's been a springboard to bigger things. It's allowed teams to deepen partnerships with health services. Also, other teams have said it's helped them engage with industry. That has allowed them to have their research to have greater impact. The funding scheme has given teams the ability to think about solving problems in a different way. It's supported research in regional and rural South Australia, and we've had clinicians who have said that it's enabled them to undertake research in their clinical, within their clinical role. So these are all the reasons why we're doing this and why you should consider applying. Okay, so let's dive into the what. What is this all about? So the Catalyst provides, as I said, targeted funding, and we're looking to fund projects that either develop or refine research projects. So these are things that you need to be considering, I suppose, before you even complete your expression of interest. So this is a two-stage application process. There's an EOI that will be required, and then teams will be invited to submit a full application. I'll discuss that in a bit more detail shortly. So when thinking about applying for Catalyst funding, you need to ensure that you're addressing a priority unmet need that is of importance to the SA health system. So this is really important because one of the first eligibility requirements of applications are that they meet a health service desirability check. So you need to be able to articulate why what you're proposing is addressing a need that's experienced by the health system in South Australia. So you might be aligning with strategic plans, or you might be addressing needs of a quality improvement project that you've identified in the past. So you need to be able to demonstrate what is the need that you're addressing for the health system. In addition, as I've mentioned, the scheme is strongly aligned with the MRFF. So you need to also be able to demonstrate which MRFF priorities you are aligned with. And so these are the 2024-26 priorities released by the MRFF. So they're available online, and we'll also have links to those. We do have links to those on our website that you can have a look at now. So in your application, you will be asked to identify which priorities your proposal is addressing, because the expectation is that within 12 months of completing your project, you will submit an application to the MRFF. So there needs to be a clear alignment with MRFF priorities and then the complementary grant opportunity that you would then be applying for. You need to make sure that you're building cross-institutional collaborations and that you're involving users within your team. So I'll talk about that also in a bit more detail shortly, but there are some really specific points that need to be addressed when you're considering your project team composition. And we're also, or the review panel also put a lens of impact and scale over the applications when they're assessing them. So there needs to be a clear demonstration of how your project will have the capacity and the potential to scale and have impact beyond South Australia. So the Catalyst scheme is coordinated by us at Health Translation SA. So we're administered by SAMRI. So awardees, grantees do enter into agreements with SAMRI between the administering as our administering institution and the administering institution of the project team will enter into that funding agreement. Oversight of the program is provided by an advisory group, and so this is chaired by Dr. Leanna Reid, who is the Health Translation SA Independent Board Chair. And this advisory group includes consumers, funders and health system representatives. So that ensures that the development of the funding guidelines, the process by which applications are submitted, reviewed, is guided by this advisory group. In addition, we have an independent review panel, again chaired by our HTSA Independent Board Chair, Leanna, and I'll go into a little bit more detail about the composition of that review panel shortly, but it's a very diverse group that provide a range of perspectives when reviewing the applications. So as I mentioned earlier, the funding is made possible by the scheme is made possible through the generous funding provided by the Hospital Research Foundation Group, the Women's and Children's Hospital and the Cancer Council of SA. So we're very grateful for the support that's provided by those three organisations. Okay, so let's do a bit of a deep dive, and the information that I'm going to discuss now is taken from the guidelines. It's a bit of a summary. The guidelines are available on our website, so you are able to look through those now. The EOIs will open on Friday, so you've got a couple of days to get your head around what we're looking for in an application and really go through the guidelines in detail. So as you've hopefully picked up by now, the goal of the scheme is to increase the number of successful SA-led applications to the MRFF. So as I said, it's expected that a project funded through the Catalyst will result in an application to an MRFF grant opportunity. You don't need to be successful, but we're looking for an increase in the number of applications to the MRFF that are led by South Australian teams. The objectives of the scheme specifically are to support translational research projects that address an unmet health or healthcare need affecting healthcare systems in South Australia. So as I said earlier, you need to be really clear. That speaks to that health service desirability check. You need to be really clear that what you're proposing is addressing a need that's affecting the healthcare system in SA. The scheme is also aiming to foster the formation of diverse collaborations between and across multiple health service organisations and health research organisations and institutes. So we're looking at groups that are from different LHNs, different universities or research institutes or primary care practices. And we've got a number of definitions around what we mean by health service organisations. And they're available on the website, and I'll talk about those in a second as well. And ultimately, we're wanting to build a pipeline of research projects that are MRFF ready. So really supporting teams to be as competitive as possible. So the funding streams that have been made available this year through the funding organisations are looking at, so Stream A is looking at improving health outcomes for people living with chronic conditions. So this stream is being funded by the Hospital Research Foundation Group. There's more detail around the eligibility criteria for each of these streams in the guidelines, but at a high level, Stream A is looking to fund innovative and collaborative approaches seeking to improve health outcomes for people with chronic conditions. And there are some conditions that are particularly encouraged by the THRF group. They are conditions such as neurodegenerative conditions, diabetes, mental health, and cardiovascular conditions. Stream B is funded by the Women's and Children's Hospital Foundation, and that, no surprise, has a focus on maternal and paediatric health and wellbeing. So projects that are addressing maternal and or paediatric health and wellbeing, along with projects focused on families. So that is, you know, a bit broader. You could look at the whole family unit as your focus of improving health outcomes there. Of note, proposals to this stream must include at least one project team member who holds a salaried position at a Witchin service. And we've got a list of what those services are in the guidelines, or someone who holds a salaried position with an HTSA partner institution with the Witchin service as their primary workplace. So again, more details in the guidelines there. And then Stream C from the Cancer Council of South Australia is looking at cancer research projects that are closely aligned with the MRFF priorities, ensuring a focus on addressing critical health needs and driving tangible outcomes. So particular focus on projects that can be adopted into healthcare practice or policy in a timely and meaningful way. So remembering that the funding available is for 12 months. So you do need to consider whether what you're proposing is feasible to be undertaken and delivered within that 12-month time period. So the eligibility criteria, the broad eligibility criteria for the scheme are that the administering institution must be an HTSA partner. So again, we've got those partner organisations listed at the bottom of the screen. And the principal lead must hold a salaried position at that administering institution. The principal lead can only be listed as a principal lead on one application to the MRFF Catalyst Grant Scheme. A principal lead could be listed on, or that individual could be listed on other applications to the scheme, but only as a principal lead on one. You're able to list a maximum of 10 team members. And as I mentioned earlier, the project must be delivered within 12 months of commencement. So you need to keep that in mind when you're developing your proposal. Now, the team composition, as I mentioned earlier, this is really important to ensure that we're fostering those collaborations between and across organisations and different sectors. So the project team must include team members from 2 different health service organisations, of which one must be SA-based, and similarly, team members from 2 different academic research organisations or health and medical research institutes, again, of which at least one must be SA-based. And absolutely at least one health consumer or community representative. So you can have, so there's obviously a minimum of 5 team members and a maximum of 10. The additional, beyond those 5 that are specified there, there's no requirement as to the roles of the remainder of the members of the project team. But we are looking again for that diversity within the project team. So whether that's people from regional, rural South Australia, people at different career stages, different ages, the diversity is something that will be considered by the independent review panel. Now, I don't think I'll go through all of these definitions in detail, but they're here for you. This webinar is being recorded, so you're able to look back on that at your leisure, but the definitions are also included in the FAQs that we'll make available. Now, the types of grants that you're able to apply for, so when you're submitting your EOI, you are asked to indicate whether you're submitting a refinement project or a new project. So as mentioned earlier, you might be, you have the choice and there's the opportunity to put forward a proposal that could be something that is refining prior work. Perhaps you'd submitted something to the MRFF or another large collaborative grant opportunity and were unsuccessful. And so you're looking at undertaking a discrete piece of work that is going to strengthen that that previously identified weakness. And so that is something that would definitely be considered for funding through the Catalyst scheme. So it may be that you're needing to engage with consumers more deeply, or you're needing to co-design a piece of work that is then going to inform, a larger program. So that the refinement project or a new project, it could be that you're piloting something new, that you're building on, say, a quality improvement project that you've undertaken within your health service and you're wanting to take it to that next step. Then this grant scheme is definitely something that you should consider applying for. So as I mentioned briefly earlier, it's a 2-stage application process. So the first stage will be an expression of interest. So these will be submitted via the Smarty Grants platform. So these will open on Friday, and there'll be a link on our website that you'll be able to access the EOI form. There will be the eligibility review and an administrative review. So we'll check that you've completed the form correctly and you've uploaded all the necessary documents, and that you do meet those eligibility criteria. And so please make sure that you read those carefully and address all of those. And similarly with the health service desirability check, as I've already mentioned. EOIs will then be evaluated by the review panel. So, as I mentioned earlier, this is chaired by Dr. Leanna Reid, and the members of the panel are very diverse. So we've got representatives from both Metro and regional South Australia. They have experience in clinical and health service delivery. They bring consumer perspectives, implementation science expertise, and research excellence. And those panel members are also joined by representatives from the funders and the HTSA board. So there's a broad range of perspectives and experience that is combined within this panel to make sure that applications are reviewed thoroughly. Reviews are then ranked, and the top-ranked EOIs will then be shortlisted. That shortlisted list is reviewed by the funders before progressing to full application. So teams that are invited to submit a full application will be asked to do that again through Smarty Grants, and those applications will again be reviewed by the review panel. And if necessary, teams may need to present to the panel if further information is required. So again, there's more detail around the assessment criteria in the funding guidelines that are available online, but this is an overview of the assessment criteria that are reviewed at the EOI stage. So specifically looking at the unmet health or healthcare need that the proposal's addressing, and how the proposal's been co-designed or been informed by consumer or clinician engagement. And also a strong focus is placed on how the proposal aligns with the MRFF, and particularly given that the scheme, the intent of the scheme is to increase the number of successful MRFF applications from SA. Applications that progress to the full application stage are then assessed against the criteria that are focusing more on the diversity of the collaboration, looking at the different individuals, their skills, the organisations that they come from, and really speaking to that aspect of, or the capacity for the proposal to scale and to have reach and the potential for impact. Feasibility, as mentioned earlier, really looking at how likely is it that the proposal will be delivered within the timeframe, within the budget, and the actual practicalities of implementing the proposal, particularly within a health system context. So a few other points to note here, and again, these are all covered off in the guidelines, but some important things to note is that the projects must commence within 6 weeks of the formal date of offer. So that will most likely be, so the commencement will be, will have to be by December, most likely. Ethics must be built into the 12-month duration of the grant. So that is really important to consider when you're designing your proposal and thinking about your timeline and budget, etc. There is a responsibility of the principal lead to respond to all reporting requirements. So teams are required to provide progress reports to Health Translation SA, and so the principal lead will be the person that is responsible for making sure that those deadlines are met. As I mentioned, the contracts are arranged between the HTSA partner organisation, who by default is the administering institution of the principal lead, and SAMRI. There will be publicity and acknowledgement requirements from the funders and HTSA, and all of that is outlined in the funding agreement that successful teams will be provided with. And successful teams will be announced at our HTSA stakeholder forum, which is on the 28th of October. So we do need at least one team member to come to that event to receive their award and probably have a few words. In addition, Health Translation SA provide successful awardees with one free registration to our Research Translation Essentials course, which is in early November, the 6th and the 7th. So we do need at least one team member at least to come to that event. And we do have wonderful feedback from teams that have come previously that course has really helped to step them up when they're implementing their project. Many actually say that they wish that they'd attended much earlier, so keep that in mind. So key dates are this Friday, the EOIs will open and they will close on the 14th of July. So that's around a bit over 3 weeks to get those EOIs in. And then the full applications, should you be invited to submit one, will be due the 8th of September. There may be some wriggle room there, depending on how long the review process takes, but we're thinking definitely in September. And this will mean that, as I said, the projects will be expected to commence by December. So the take-home messages are that this scheme is a little different. It's so you need to approach it in that way. You need to remember that we're looking for collaborative projects across healthcare services and research organisations that are informed and developed with consumers and stakeholders, and obviously that are aligning with those MRFF priorities. You need to be addressing these points and making sure that they come through in your proposal so that you're revolving around health system priorities, you're aligning with the MRFF. We're supporting local initiatives that have the potential to scale and have impact in the future. So sort of think local, but have that broader application in mind. The projects need to be completed within 12 months. You need to have a strong implementation and translation focus, and there are key questions within the EOI and the full application that will give you the opportunity to really articulate that. And if you already have existing relationships established with collaborators, consumers, health service organisations, industry, build on those and really make sure that you leverage those within your application. Now I'm going to, I'll leave this slide up for a minute and then we can just open up to any questions. So I think we've had some come through. I've collaborated with a peer worker on previous projects. They've lived experience of a mental health condition and are in paid position at SA Health. Would they qualify as the consumer investigator on the project? Yes, they absolutely would. Thanks, Suzanne. Okay, so we've got a question about are UniSA and Adelaide now considered a single institute? I might have to get back to you on that one, but that's a very good question. Are there any issues related to working with private hospital providers rather than SA Health public hospitals? No, there's not. We would welcome applications that have that diversity of team structure. Past applications have, say, included GPs from private GP practices, so that would be a similar sort of scenario to this one. I'm from Narlan, and as Narlan is not an administrative institution for MRFF, can we still be a lead site for the Catalyst grant? Yes, you can. These are great questions, and we do have a frequently asked questions document that's not online at the moment, but we'll add these types of questions to that, and that will be updated sort of in a live manner, so you can refer to that online as well. What are the success rates for EOI and final application? I don't have that off the top of my head, but I will include that in that document. Thanks, Sabin. How are we going for time? Good. So I'll just say my thank yous because we might finish a little early, but of course, thank you again to the funding organisations, so the Hospital Research Foundation Group, Women's and Children's Hospital Foundation and Cancer Council of South Australia. Without you, this wouldn't be possible. So it's fantastic that, and what a great example of working collaboratively as well for improving the health outcomes for South Australia. I'd also like to thank the many people that contribute to the development and the evolution of this grant scheme. So particularly the advisory group members, the members of the review panel, and also the members of the SA MRFF working group who have all provided different perspectives and input into this scheme, and as it continues to evolve as well, each round, it gets refined even more. And specifically, personally, I'd also like to thank the HTSA staff team. We're a small group, but we're small but mighty. So thanks everyone in the team for pulling today together. We've just got a few more questions coming in. Was there any feedback provided for last year unsuccessful applications? Yes, there was. We were able to provide some sort of some overall feedback that gave indications around what a successful application looked like, and then areas where individuals could improve for next time. Okay, well, we might wrap it up. Everyone, I'm sure, would be happy with 10 minutes early mark. If you do have any questions, please just contact us via that inquiries email address, and we will do our best to respond to that quickly. And as I said, the information will be available on our website, so hop on there, and we look forward to receiving your applications. Thank you.